It's been just over 2 weeks since having an arthroscopic meniscectomy to repair my torn meniscus, and I'm now less than 100 days from the start line of Ironman Coeur d'Alene. So today I'm going to show you phase 2 of my rehabilitation program. I'm Joe Klinedinst of JK Endurance Coaching, and this is my journey from knee surgery to Ironman in 115 days. Phase 2 transitions into some more dynamic movements as well as more resistance in the way of some ankle weights. I would strongly recommend not moving into this phase until you've had your post-op appointment with your doctor or your surgeon. For those of you watching that aren't coming from a knee surgery or a knee injury, this is also an excellent preventative strength program to help you with the range of motion and keep you running healthy. The program itself should take about 30 minutes. Check out the link in the show notes to go to my website and download a PDF file that allow you to copy and paste these into your training software, whether it's Training Peaks or something else. To complete these exercises, you'll need to get yourself some ankle weights. I picked up this pair at Amazon for 30 bucks, and they're pretty slick because they have these little 1-pound sandbags that you can insert or remove. So really you have like 1 pound up to 5 pounds per ankle. You also need a resistance band or a stretch cord. Let's go ahead and run through the exercises in the phase 2 program. One of the things that's not on the workout list is the knee locks. That is one thing that I didn't include there, but definitely would want you to keep doing those. I try to get at least 100, 200 reps a day, just times when maybe you're at work, standing around, or you have opportunities, like sitting around watching some television, eating or something, where you just kind of keep getting those good leg lock squeezes of the quad. Okay, so the first move of the actual phase 2 is going to be the fast cadence to leg stance. Okay, so what we're looking to do here is like a fast cadence, 2 to 3 like foot steps, and then pause in a leg stance. Okay, so it's okay, so about 30 reps and then 2 to 3 sets. Okay, everything again, always a progression. So day 1 of phase 2, maybe you just go 3 sets of 10, you break it up. But you will ultimately want to get where you're going 30. That'll help get the heart rate up a little, get you moving. Next up is the bent knee glute bridge. So we're going to get on our back, flat on our back with our knees bent. Okay, and we're going to use our hips up and squeeze and back down. For the glute bridges, you want to be doing 3 sets of 10. There's 2 progressions with the glute bridges then. You could add like a medicine or an exercise ball that or elevate your legs up to make it a little tougher, or you could obviously add more reps as you begin to make, once the 3x10 starts to feel easy, you could increase the reps with that. All right guys, this one is called a lateral step up with stability. So the idea is we're starting flat on the ground. We're going to step up onto a surface of, this is a good height. If anything, you could go up maybe a couple more inches as you build some strength. But the ultimate goal here is to use only the legs muscles here. We're not pushing up into a stance position. We want to use this leg to drive us up. Okay, so, and right now, think again, like a running pose. We're in this position. We're going to drive up with this leg, up, hold, and down. Okay, up, good hold, and down. Okay, and then you can also add in the stepping the whole way down. So I would, the progression would be, I would start here and, just the first week or so or doing them, first day or 2, get a feel. And then we want to progress to step and explode up. And of course, we're going to go back to the other leg as well. Okay, so here. So we're going to be starting, again, this is my, injured knee. I'm using that to drive myself up, and we'll progress to. Now, as far as standing squats, we had those, but in phase 1, we just did mini squats. So our goal was only getting down, maybe 45 degrees. So now we want to try to work our way to full 90, or once you get 90, even a little below 90. Okay, so same, good shoulder width with the legs, and we're coming down and up. Okay, we're also going to up our reps. So we're not only progressing in a deeper squat in phase 2, okay, but we're also now going to 15 reps, still unweighted, okay? But a higher number of reps. Now we're gonna strap up our ankle weights for the next few exercises, starting with our leg raises, okay? So I'm currently using 3 pounds in my ankle weight. So again, I have the ability to go from 1 up to 5 pounds with this particular style. And again, we are doing both legs. So, I'm putting ankle weight on the non-injured knee as well as the injured side. Now the progression with the leg lifts, not only are we adding the weight to those, but the goal eventually is to also combine the straight leg lift with the T and the V. So you would go 30 straight reps with one leg and then switch to the other leg. Now with the added weight, I haven't gotten to that point yet. I'm kind of alternating 10, 10, back and forth, 10 and 10. Okay, but ultimately our goal is that we can knock out 30 straight with one leg. Okay, and then we would only go down to like 2 sets. Okay, so again, we don't want to lay back. If you lay the whole way back flat, you're going to bring in too much core. So we want to make sure we're using hip flexors and the quads, the muscles we're really trying to work here. Okay, so again, the legs straight. So we're going to do the ultimate goal, like I said, we would be to go through 10 with straight. And then we would go into our V shape for 10. And then after the V shape, we would come up and do our T shape. Now that we have the ankle weights on, we're going to stick with a few exercises with those. So for the next one, you're going to need something to sit on. I brought my kind of my jumping block out here, but a chair, anything, as long as you have enough distance to do your leg extension. So let me get that set up. Open chain knee extensions with the ankle weights. Okay, so again, just 10 good reps. We're going to lock it out at the top. Okay, with these, I could see where you would progress to even putting 2 of the ankle weights on the same leg, because I could easily add those additional 2 pounds and probably even, I had done that the other night actually, where I used both ankle weights on one leg for a little more resistance here. So we get 10 reps with this leg, and we go left leg 10 reps. Okay, so our calf raises are same thing we had done before, just now we got the ankle weights on. Okay, another progression you could do with these, you could go to a stair or an edge of a wall or something. Patio, since I'm outside here, and you could do those to give you that little bit of flexion on the way down. Okay, we got 3 by 10 with the weights. Next up is our standing knee flexion, working our hamstrings. Okay, so again, we're standing and keep that knee pointed down to the ground. And 10 on the other leg. So our last exercise is our terminal knee extensions. So we're going to take, like I said, a stretch cord or a resistance band and hook it to some kind of a, object that's not going to move on us. And we're going to put that just behind our knee. And then the amount of resistance you're comfortable with is how far, how much you want to back off away from the table here. So then we're going to start with a bent knee, get everything nice, all of our alignment, everything's nice and straight. And we're going to flex that knee back, hold 1, 2, 3, and relax it. Hold 1, 2, 3. Everything's in nice alignment here. Okay. So again, as you get through the progression, you're going to be able to keep kind of moving yourself further away to add more resistance to this exercise. Okay, once we wrap up with our terminal knee extensions, we're going to do some stretching. The gastric stretch is a good one. We want to keep that one in there. Okay, so we're going to be working, continue to work through with that. And along with that stretch, you can also progress into doing some like foam rolling and some other stretching on your own. The consistent rehab exercises I'm doing is really helping me return to normal training. Don't miss those next episodes to see how my return to swimming and running is going.